I'm OJ and I'm the patient lead on the PRSB Diabetes project. I've been living with diabetes myself since 2013 and I'm a type 2 patient. I know how important information can be in allowing me to manage my diabetes well and live to the best of my ability. As a patient lead on this project, I hope to put the needs of diabetes patients across the spectrum at the heart of the two standards we're developing. So the purpose of the video is to introduce you to the types of diabetes care information we'll be discussing in the upcoming webinars. And secondly, to give you some background knowledge to help you participate fully in the discussion and share your thoughts and experience. The Professional Record Standards Body develops information standards for care records. These standards help people and professionals to share information digitally for safer and better care. The PRSB has been commissioned by NHS England and NHS Improvement to produce standards for digitally sharing diabetes information. So 1 in 10 people in the UK live with diabetes. If poorly managed, diabetes can lead to heart disease, vision problems, kidney disease, and other complications. With good care, people with diabetes can live a healthier life. Better information sharing, such as on blood glucose results, can help improve people's care and their outcomes. There are 2 key issues for digital information sharing for a person with diabetes that this project will address. Improving the diabetes information that is shared digitally between professionals in different care settings, so people's care is improved and they don't have to repeat their story. And secondly, improving sharing of self-reported data for diabetes, which is held in apps and devices that clinicians need to access for treating people with diabetes. So our starting point is that we're not creating these standards from a blank slate. We'll be drawing on existing standards that already set out best practice. We'll be focusing on information specific to diabetes care, such as glucose and insulin measures, targets, screening activities, such as foot and eye checks, and education. So people with all types of diabetes and whose information and care needs may be different will be involved in this project. We aim to uncover all the different needs so the standards are as inclusive as possible. So in the first webinar, we'll be going through a diabetes care plan and we'll discuss the different information needed for care planning. The second webinar will focus on self-reported data gathered by people with diabetes themselves.
Care planning is a really important part of someone's diabetes care. Care planning is a way of recording a conversation with someone rather than a consultation. Care plans involve asking people about what's important to them and their health, what their goals are, their aspirations, and what it is that they want to achieve in terms of better health outcomes. And that's exactly what care planning should be. A model care plan should include information such as people's metrics and what they've achieved in terms of outcomes. So that could be their blood pressure, their sugar levels, and so forth. It might also allude to things that people want to achieve in terms of their goals and aspirations. Those goals should be put down in terms of what's important to them, how likely people are to achieve them, what obstacles there are to those goals, and what barriers and things will get in the way of them achieving that. There should also be some reference to follow-up. So if someone has a care plan in place, when are they going to meet again to review that and see whether they've achieved what it is they want to achieve. The care plan should ideally be done once a year, perhaps as part of the annual review. People may have care planning done more often than that, where they are following up a pre-existing care plan, and that's completely fine. But I think as a bare minimum, once a year is how often people should be having a care plan done to set down their goals and objectives and to follow that up.
So the types of issues we'll be discussing will be, do you have all the information you need to fully engage with your clinician when creating and discussing your care plan? What topics do you discuss with your clinician at your annual review or care planning meeting? What information do you find most useful to support your discussions?
We often talk very much about how diabetes is a self-managed condition, but the information that is required to undertake effective self-management is something that we don't routinely record. So we're not good at recording the actual doses, for example, of insulin that an individual might use. We're not good at recording the actual impact of those doses with glucose levels. And so what we're hoping to bring out through this self-reported data standard is really the detail and the complexity of some of those issues so that we can bring those into the light. So we're thinking about often the information will come from technological devices, so finger stick glucose meters, or from increasingly we've got connected insulin pens and things like that, or of course from more detailed glucose monitoring equipment. So I guess we're talking about self-reported data as really anything that comes from a device or from the person with diabetes.
For this webinar, beforehand, you may wish to think about what data you gather daily or weekly and what it looks like, because we want to discuss issues such as what data do you collect and how do you use it to manage your diabetes? What do you share with your clinicians and what else would you share if you could? Are you confident interpreting medical data about your diabetes? Has COVID-19 affected the way you manage your diabetes? Thank you for watching this video. We hope it's been helpful in setting out what we will be discussing during the webinars. We look forward to seeing you and thanks again for your support with this important project.